Bacterial meningitis is a serious and potentially life-threatening medical condition characterized by inflammation of the meninges, the protective membranes that surround the brain and spinal cord. This condition is caused by bacterial infections, which can spread to the meninges through the bloodstream or nearby structures, such as the sinuses or ears. Bacterial meningitis requires immediate medical attention due to its rapid progression and potential complications. Causes of bacterial meningitis. Several types of bacteria can cause meningitis, and the most common ones vary depending on age, geographic location, and other risk factors. Key pathogens include Streptococcus pneumoniae, pneumococcus. The leading cause of bacterial meningitis in children and adults. Often associated with pneumonia, sinus infections, or ear infections. Neisseria meningitidis, meningococcus. Common in adolescents and young adults. Can cause outbreaks, particularly in close contact settings like dormitories or military barracks. Haemophilus influenza type B, HIB. Once a major cause of meningitis in children, now significantly reduced in regions with widespread HIB vaccination. Listeria monocytogenes. Affects newborns, pregnant women, the elderly, and individuals with weakened immune systems. Often contracted through contaminated food. Escherichia coli. A common cause in newborns, often transmitted during childbirth. Transmission. Bacterial meningitis is not highly contagious, but it can spread from person to person through respiratory droplets, saliva, or close contact. Some bacteria, such as Neisseria meningitidis, can colonize the throat or nose without causing symptoms, allowing carriers to unknowingly transmit the bacteria to others. In certain cases, the infection may spread to the bloodstream and cross the blood-brain barrier, reaching the meninges. Symptoms. The symptoms of bacterial meningitis typically develop rapidly and can vary by age group. Common symptoms include severe headache, fever and chills, neck stiffness, nausea and vomiting, sensitivity to light, photophobia, altered mental status, such as confusion or difficulty concentrating, seizures, sleepiness or difficulty waking up. In newborns and infants, the signs may be subtler and include irritability, poor feeding, lethargy, and a bulging soft spot, fontanelle, on the head. Risk factors. Certain groups are at higher risk of developing bacterial meningitis, including age. Infants and young children are more susceptible due to immature immune systems. Adolescents and young adults are at risk for meningococcal meningitis. Living conditions. Crowded environments like dormitories, schools, or military bases facilitate the spread of bacteria. Medical conditions. Immune deficiencies, head injuries, or prior infections increase susceptibility. Vaccination status. Lack of vaccination against certain bacteria, example HIB, meningococcal, or pneumococcal vaccines, raises the risk. Pregnancy. Pregnant women are more vulnerable to Listeria monocytogenes infections, which can cause meningitis in both the mother and newborn. Diagnosis. Early diagnosis is crucial for effective treatment. The diagnostic process typically includes medical history and physical exam. Doctors check for symptoms like neck stiffness and other neurological signs. Lumbar puncture, spinal tap. A sample of cerebrospinal fluid, CSF, is collected and analyzed for the presence of bacteria, white blood cells, and other markers of infection. Blood cultures. Used to identify bacteria in the bloodstream. Imaging tests. CT or MRI scans may be performed to rule out other conditions or complications. Treatment. Bacterial meningitis is a medical emergency that requires prompt treatment with antibiotics. The choice of antibiotics depends on the likely causative bacteria, patient's age, and health condition. Commonly used antibiotics include ceftriaxone or cefotaxime, vancomycin, ampicillin, for Listeria monocytogenes. Supportive care may include intravenous fluids, corticosteroids, to reduce inflammation, and medications to manage complications like seizures. Complications. Without timely treatment, bacterial meningitis can lead to severe complications, including hearing loss, seizures, brain damage, hydrocephalus, fluid accumulation in the brain, death. Even with treatment, some survivors may experience long-term effects such as cognitive impairments or physical disabilities. Prevention. Preventive measures are essential to reduce the risk of bacterial meningitis. Vaccination. Vaccines for HIV, pneumococcus, meningococcus, and other pathogens have significantly decreased the incidence of bacterial meningitis. Antibiotic prophylaxis. Close contacts of individuals with meningococcal meningitis may receive antibiotics to prevent infection. Good hygiene practices. Frequent hand washing and avoiding close contact with sick individuals can limit the spread of bacteria. Safe food practices. Pregnant women should avoid high-risk foods like unpasteurized dairy to reduce the risk of listeria infections. Conclusion. Bacterial meningitis is a severe condition that demands urgent medical attention. Advances in vaccination, early diagnosis, and treatment have significantly improved outcomes for patients. However, awareness of symptoms, risk factors, and preventive measures remains critical to combat this potentially devastating disease.
Thank you for watching. Please subscribe our channel.